I'll just very briefly just summarize the study that we did that we're currently submitting for publication, which is basically a study we did with Paul Ernst in the U.S. looking at hard aberrations. We compared femto laser in this study versus manual, understanding that femto laser provides, of course, a more predicted and a more circular rexus with good capsular overlap, as opposed to a manual, which may be more variable. And we particularly looked at higher order aberrations in this study, and we compared femto laser versus manual with different presbyopic IOLs. And we looked at HOAs postoperatively, and we assessed questionnaires for patients as well, looking at outcomes. What we found, actually, we had less internal coma. And remember, when we're measuring aberrations, we can divide them up in terms of total eye, corneal, and internal. Here we're particularly looking for internal because a lot of that is certainly composed of the IOL itself. And what we found is actually there was less internal coma and trefoil in the femto group, meaning with good capsule overlap consistently, versus the manual. And this was something that had been shown by some of our German colleagues many years ago as well. And then we also looked at the difference in terms of patient satisfaction and quality of life and satisfaction. What we found, actually, overall, there was no big difference in terms of femto laser versus manual, but we did find patients who had less coma had better satisfaction. So if we had patients who have less coma, vertical, horizontal coma, less HOAs, these patients typically had better satisfaction in terms of visual quality. So it goes to say that, of course, if we have a procedure that's going to result in less HOAs, we're likely to show an improvement in terms of visual quality. And this has certainly been a big reason why femto laser has been touted as potentially being a benefit. And again, I think evidence still needs to be proven in terms of clinical outcomes, but theoretically at least, and certainly when we come to the development of this, femto laser has certainly been one of the big things of femto laser, of course, along with astigmatism correction and lens fragmentation, has been a consistent capsulotomy. Of course, it's a pretty big system to do this, and I think if you think about where ZEPTO fits in here, I think we would say basically this is a similar argument.